The number of COVID cases in the country is only increasing and the rise in cases has been fairly consistent. India is on an average reporting a positivity rate of 5% and more. The variant that is circulating in India is XBB.1.16, and what we know right now is that it has mutated further to XBB.1.16.1. Definitely there is a growth advantage is what experts have to say.
What is concerning with the new variant XBB.1.16 that it contains the F486P mutation, which is basically a new type of mutation occurring in a key hotspot on its genetic code. That's a 486th position. Multiple mutations have occurred in this particular area, showing that this indeed is a hotspot. F486P is considered difficult to achieve, and this particular sublineage, XBB.1.16, has achieved that. Does that necessarily mean it is more dangerous? We do not know, but clearly we can see that a rise in cases has coincided with the discovery of this variant.
However, experts also say that there are few things we can do to be safe. We need to go back to the basics. We might have forgotten all about masks and social distancing, but perhaps that really is our weapon against this infection.
The most important thing to follow is to wear masks, especially when we are going outside into crowded areas or going into the area, meeting with people whom we do not know. Because as we have known in the past that mask is the most important barrier in preventing the infection, spread of infection, breaking the chain of infection.
People who've received the 2 doses of the vaccine and also the 3rd dose essentially, which is the booster dose, are in fact safer than the ones who haven't. If you haven't taken the 3rd dose, this is your reminder, you must get one.
No doubt that those people who have been vaccinated have less incidence of severe disease, less incidence of hospitalization, and thereby less mortality or death.
Let's talk about the symptoms right now. Well, it's cough, fever, runny nose and sore throat. It's important to not take any medicines, especially antibiotics against COVID, because COVID-19, it's coronavirus. It is not a bacteria. Hence, antibiotics will not work against this virus. In fact, it's only going to make you drug resistant.
जो हम देख रहे हैं इस बार काफ़ी माइल्ड केसेस हो रहे हैं, लोगों को खांसी, जुकाम, गला दर्द, बुखार भी हो रहा है, बट वो अपने आप ही घर पे ठीक हो रहे हैं. इस बार हॉस्पिटलाइजेशन की ज़रूरत भी कम है.
Most of the symptoms, they are settling within 2 to 3 days or 4 days. There is no role of taking antibiotics in a viral infection.